Okay. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and we're going to begin our joint City Nueces County press briefing on COVID-19 for today, which is the 28th of April. And so I'll be speaking today. I'm going to be going over our statistics as we normally go over in a 24-hour period, providing an update for that past 24 hours. I'm going to just give the public a quick update on what we're doing as a city organization to get some of our operations slowly back to some level of business that we had prior to about 8 weeks ago. And just a couple of quick reminders on some of the small business recovery loan program that we have, as well as assistance for residential homeowners and renters if they need payments assistance for their rents or mortgages, as well as utility assistance. Annette Rodriguez, our Public Health Director, will speak this afternoon too, reminding us of some of the CPAP and the BiPAP donation protocols that we have in place if people want to donate those materials that are necessary, and also to remind us on some of our social distancing guidelines and requirements that we should still use to keep ourselves safe. And then County Judge Barbara Canales is here. She's going to talk to you about some of the adjustments they've made in the countywide orders to be in line with the governor's orders that were issued yesterday to go into effect on Friday. And then Mayor McComb is here as well, and he's going to talk about how those governor's orders impact his orders that he issued for the city, as well as provide an update on the mayor's disaster recovery fund that has been funded by many in the community to help in situations where people need financial assistance. Okay, so with that, let me begin with our statistics or our update. Each day at 4 o'clock, we look back at the past 24 hours and see what new cases, if any, we have had in Nueces County from our testing. We also look at things like number of deaths. We look at the number of tests performed as well as recovery rates, and so that's what I'll go over. This information is an update from yesterday at 4, and so in the past 24 hours, as you can see on the graph in the far right or my left, we've had 0 new cases. That follows 5 new cases that we had the day before, and you can see the trend over the past couple of, I guess, 7 days here. We had 0, 1, 1, 2, 0, 5, yesterday, but today 0 additional cases, and there was testing performed, and there was 0 results, and I'll get to the testing in a little bit. To date, we've had 3 deaths in Nueces County. 2 are from persons that were actually living here at the time of their death, and then 1 person, a traveling nurse who was working in Nevada, although he had a permanent residency here, so we have to, according to CDC guidelines, count him. So 3 deaths in Nueces County because of COVID. The distribution between male and female is pretty consistent. There's 53% or 52 males that have been diagnosed with COVID are male, and then 47 of the 99 are females that have been diagnosed with COVID over time. That's 47%. We look at the age distribution of those that have had or have COVID, and we classify this over 9 age brackets beginning from 0 to 19, and then we look at 8 other brackets with a 10-year increment, so 20 to 29, 30 to 39, 40 to 49, and so on. The point to bring up here is that the 6 classifications of age between the ages of 20 to 79, they're pretty consistent in the distribution of those 99 persons that have had or have COVID. And so the message is that the virus doesn't pick one age group over another. Any and everybody is susceptible to getting the virus if they don't watch some of their activities and follow good hygiene. Let's talk about testing. So testing in our area includes what this report is what has been analyzed in the lab to see if a specimen tests positive or negative. And we look at what we do at our laboratory. We're one of 10 authorized labs in the state to perform tests. The city has a microbiologist, which is a highly trained person that looks at the material through a process. And then we also report tests that have been sent from the hospitals and clinics and private physicians to some of the commercial labs, like a LabCorp, or a Quest laboratory. And so today in our labs, we tested 57 specimens or analyzed 57 specimens between late last night and today. And then hospitals, clinics, and physicians have sent off to private labs a total of 39 specimens to be analyzed. So in total, just under 100 tests analyzed in Nueces County today. And that brings our total, since we've been tracking this, to about 2,288 tests performed. I wanted to show you this, if we can go back to this graph here. Yesterday, you may recall, if you tuned in yesterday, we did a drive-through testing site at the former Memorial Hospital. There were a total of 98 specimens taken at that drive-through site at the former Memorial Hospital parking lot. From those 98, we've concluded all the tests in our laboratory, and only 2 positives came out of those 99 tests that were analyzed. So we thought that would just be something good to show. We encourage people, if they have the symptoms, if they have any of the qualifying reasons to be tested, to call us, and Annette can talk about how to proceed with doing so. But this is a good sign that there's a lot of people that are getting tested, but our positive rate is relatively low, at least through yesterday's drive-through testing operation. We want to talk about persons that have been hospitalized and those that have been recovered and discharged and who's in the hospital today. So since we have been tracking this, we've had a total of 21 persons in the hospital. Today, 3 still remain in the hospital, and that 21 wasn't all at once, but over time, people have come and gone. And so today we have 3 in the hospital. 1 of those 3 is in ICU, intensive care. The other 2 are recovering in the hospital under normal circumstances. And then to date, this chart here shows us 39 persons have recovered. And so when you look at the total, that should be 99. 39, or about 39%, have recovered, and then the remainder are still diagnosed and recovering. And then let's talk about location. That's something that the community has been interested in. So of the 99 persons, Corpus Christi, obviously being the biggest city, has the predominant number of those. It's 84 of the 99 within the city of Corpus Christi. 2 are within Robstown. 7 have been within Port Aransas. And then the remainder, 6, are within rural Nueces County. Okay, so that's an update on the statistics. I'm going to talk about a few other things. Did you want to translate or keep going? Or?
I can translate this one now.
Okay, all right. We'll do a quick translation, and then I'll just talk about a couple other things, and then we'll have Annette speak.
En resumen, en las últimas 24 horas no se han reportado casos nuevos por el virus. Actualmente en el condado de Nueces existen 99 casos confirmados por el coronavirus. Entre esos, 52 son varones, 47 son mujeres. La mayoría se encuentran en el rango de edades entre 30 y 39 años. En total se han llevado a cabo 2,288 pruebas entre hospitales y el Distrito de Salud Pública. De los 99 casos, 84 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas y 6 son residentes de áreas rurales. 39 de los 99 casos se han recuperado por completo, 21 han sido hospitalizados, 3 continúan en el hospital, 1 en condición crítica en la unidad de cuidados intensivos. A la fecha son 3 las personas fallecidas en el condado de Nueces.
Okay. Okay, I'd like to speak now with the community because the city is we're not a business per se, but we do have a big impact in the community. We have a $1 billion budget that's being reviewed, obviously, with the downturn, but we have over 3,000 employees in 32 different lines of business, 32 different departments. And so this morning, given the fact that the governor issued some reopening orders yesterday, some of those impact how we conduct business. And so this morning, I met with my executive leadership team, and we developed as a team, we outlined a course of action to begin to adjust city services that have been modified because of COVID-19. So basically we said, okay, how are we going to reopen so that, one, we're safe, not only for the employee, but for the community that we interact with. What we've decided as a team is that we're going to require every department to develop a written plan on how to proceed to either open, that it may have been completely closed, or continue to operate in a bigger fashion if they've been modified because of the COVID-19. We will not reinstate any operations. That means employees who may be at home on administrative leave because their operation is closed, like a library, or persons that are telecommuting. We're not going to have anybody come back to their place of permanent work until we have reviewed those, until I have reviewed their business plans to make sure that they have appropriate accommodations to keep the employee safe and to keep the public safe. And so that'll happen hopefully by this Friday. We'll be beginning to look at some of those plans. And beginning next week, we'll begin to see how do we return some of our business operations back to not necessarily what was there 8 weeks ago, but something reflective of our current situation that we have with the COVID pandemic. So all our directors, who are the professional leads of each department, we have a leadership team of about 60 persons or so when you consider the directors and assistant directors. They're working on those plans now, and we'll be able to look at them across all the 32 departments to see their similarities. Did one department maybe not do something that another did? And make sure that all those plans are appropriately reflective of some of the protocol we should put in place. That includes following some of the recommendations from the governor of yesterday, to include when you walk into a building, there should be either a place for persons to wash their hands or some sanitizer for their hand. It includes 6 feet distancing, so if people used to be 2 in an office and there wasn't 6 feet distance, we're going to have to move one of those persons out of the office. It includes having big enough rooms to have a conference type of a meeting. We've already removed chairs from City Hall and put them in storage temporarily, so that a room that used to fit 12, 14, 16 people is now only fitting 6 persons. And so we've already made those adjustments. These changes go beyond some of these office changes to include changes in our first responder situations, in our health district, in our libraries, and so on. Just to note for the senior community and others that rely on that important service, while we're providing meals to go at our senior centers, the governor specifically said the senior population is one that is most vulnerable, and we need to make different accommodations for them. And so our senior centers will not be opening anytime soon. We'll continue to evaluate how things go over the next couple of weeks, and we'll make a determination then. Also, as noted in the governor's order, in his specific order, we're not allowed to open our swimming pools. And so pools that are open year-round, like the Collier Pool and the natatorium, those will remain closed. So I want to make sure those that love to swim know that, so they're not wasting their time driving out to those operations. And then we also check, these aren't necessarily city-run businesses, but we work real closely with them, or city operations. We looked along the Bay front here. There's 5 destinations, to include the Lexington, the aquarium, and 5 art-related centers. And I'll give the community a quick update that comes from the CEO of each one of those operations. We checked with them this afternoon. And beginning on the North Beach side, so the USS Lexington, they are looking at mid-May to potentially reopen, May 18. They're in the process of doing some improvements to the interior of the USS Lexington, and because of that and the governor's orders, they will not be opening right away. They're going to look at that phase 2 timeline of May 18. The Texas State Aquarium, run by Tom Schmidt, the USS Lexington is Mr. Banta, but the Texas State Aquarium, the Texas State Aquarium, similarly May 18. They have a good protocol plan in place that's drafted. In fact, we use that as an example for our directors, but he's looking at phase 2, specifically with some new orders that were provided, or new information provided to him by the governor this morning. When we transition a little bit more this way, the Museum of Science and History, the Corpus Christi Museum of Science and History, they are looking to open the first week in June, so not till the first week in June. They have several, at least half of their installations are hands-on type of a application or an installation, and they don't think it'd be fair for the customer who's paying to only be able to use half. Plus, they're doing some renovations inside of their own, sprucing things up, and so that first week in June is what they're anticipating. Right across the grass, the Art Museum of South Texas, similarly, they're looking at that 1st of June. They are working with staff now on getting things reopened or ready to reopen in June, and working on some guidelines and training, and so June, the first week in June for them as well. And then closer down here to the middle of the bay, the Art Center of Corpus Christi. They have galleries in there. They also have activities for artists and families, and they are going to open the gallery only on May 5th. So there's a gallery that has local artists' work that's displayed. You can buy it. It's a beautiful center in there. But May 5th is when they'll open the gallery, and all other things will not open yet. So things like activities that they have, classes, camps, they're going to continue to monitor the governor's guidelines, and those will be opened accordingly. Okay, and then we're going to shift right quick just to assistance. So we have 3 programs for the community. If you're a business person, the City Council approved funding for small business loans. Those are administered by a third party that we have a long working relationship, the Lift Fund Incorporated. Their telephone number's here, 888-215-2373. Their application for small businesses is liftfund.com. And they're processing loans to date. 9 loans have been completely funded at about $185,000. They also have 8 loans in final stages of about $110,000. So about $300,000 in loan assistance is either funded or close to being funded. The City Council funded $1.7 million initially, and another $1 million is in ready to go in case that 1.7 is used up. So there's a lot of capacity there still. So if small businesses need loans, you should call that number or go to that website. A key thing to remember, though, and one of the reasons the money's not going quicker, is you have to get all your paperwork in. And so there's requirements for bank statements for the last 3 months and that type of thing. So that's one of the reasons why we've had several $1 million in applications. Some of them aren't being processed as quick, and that's because the businesses need to get all that information in. And then if you're a renter or a homeowner that pays the rent or a mortgage and you have utility, if you're having difficulty because of lost wages, lost job, there's 2 agencies that we've contracted with, the Corpus Christi Hope House and the Salvation Army. Corpus Christi Hope House is 361-852-2273, and then the Salvation Army is 361-884-9497. Those offer rental assistance, help you pay your rent, and help you pay your mortgage, and help you pay your utilities. In total, there's $1.6 million allocated to both of those programs or agencies. You can call either one, it doesn't matter. And to date, this has only been a week, we've received over 205 applications, and about 30 households have applied with $32,000 in assistance being requested. So that concludes my portion of the briefing. We're going to turn it over at this point to Annette Rodriguez, who will provide us some updates on the health side.
En resumen, ayer el gobernador Greg Abbott emitió una orden ejecutiva relacionada con la reapertura ampliada de los servicios como parte de su plan estratégico seguro para abrir Texas en respuesta a la pandemia. Su orden reabre Texas en fases a partir del viernes 1 de mayo. La ciudad de Corpus Christi también está adoptando un enfoque gradual, seguro y estratégico para reanudar las operaciones comerciales modificadas. Hoy, todos los directores de los 32 departamentos de la ciudad recibieron una nota mía pidiéndoles que desarrollen un plan de acción para reanudar las operaciones modificadas de la ciudad para mantener un ambiente de trabajo seguro y saludable para todo el personal y el público de la ciudad. Cada plan de acción incluirá protocolos efectivos de limpieza, mantenimiento del distanciamiento social de 6 pies, uso de equipo de protección personal y cambios en los espacios de trabajo según sea necesario. Le queremos recordar que los centros para adultos mayores aún seguirán cerrados hasta que tengamos otro plan de acción. También incluyen las albercas y otras operaciones en la ciudad. Atracciones como el USS Lexington va a continuar cerrado, así como el acuario estatal. Posiblemente reabran en la fase 2 a mediados del mes de mayo. Otros museos posiblemente abran hasta junio, como el Museo de Historia y Ciencia. El Centro de Arte va a abrir su exhibición el 5 de mayo. Sobre el programa de préstamos a pequeñas empresas, Lift Fund, han sido ya 242 las aplicaciones solicitadas por negociantes quienes se han visto afectados por la pandemia. Quiero recordarles a aquellas personas que van a realizar una solicitud que envíen toda su documentación necesaria para apresurar así el proceso. Para más información puede llamar al 1-888-215-2373. Sobre la Acta Cares, la ciudad recibió $1.6 millones que podrán ser utilizados por los residentes afectados por la pandemia para hacer pagos de rentas, hipotecas y servicios. Para más información puede comunicarse al Ejército de Salvación al 884-9497 o a la Casa Esperanza al número 852-2273.
Thank you. Good afternoon. Annette Rodriguez, Health Department Director. So today was the first day to drop off your sleep apnea machines at Del Mar West Campus, and the address is right there on the screen at 4101 Old Brownsville Road from 3 to 6 p.m. Collection continues this Thursday and Friday, April 30th and May 1st from 3 to 6 p.m. This is a really good opportunity to clean up your house. If you have an old sleep apnea machine laying around and you want to get rid of it, we'd love to have it. Please donate it. Consider donating it to the Health District, to Del Mar, so we can get it cleaned up in case we ever need that. As businesses reopen on May 1st up to the 25% capacity, the most important part of reopening is for a business owner to have a plan. The Centers for Disease Control and Prevention, CDC, as well as the World Health Organization, WHO, have been recommending for months now that we have a plan to be able to mitigate COVID-19. So what does that actually mean? I think a lot of people here have a plan, but what does it mean to have a plan? It means you must look at the place where you work and figure out how to both safely operate and social distance in order to continue to run your business efficiently. Look at every door, every entrance, every exit, every moving part that is part of your operation. Look at your operation under a microscope, so to speak, and see how you can limit exposure between people while still safely conducting your business. Social distancing is key to effectively mitigating transmission of the virus. Each business is unique, and for some, it will be very challenging to come up with a plan, especially when it comes to social distancing. It can be done by being creative and adding some element to your business functions that you never did before, such as conducting a portion of your business away from your business or a portion outside of your establishment. So we've even talked to restaurants about maybe using part of their parking lot as part of an outside patio. This virus has some airborne qualities to it, and proper ventilation when dealing with airborne diseases helps decrease transmission. You may say it's already hot outside, and I agree completely. But these are challenging times to be thinking outside of the box, and it's going to be critical for everyone as we move forward. Be innovative. Use those creative things that everybody's thinking about. How can I do it? If I wanted to make a change, how can I do it and make a change and be very effective? Again, social distancing is going to be key to everyone staying safe. So do your part to stay 6 feet away from each other and wear your mask if you're not able to do that. Stay healthy, stay protected, and as always, stay informed. Thank you.
En resumen, hoy fue el primer día en que se aceptaron las donaciones de las máquinas para tratar el apnea del sueño en el Colegio Del Mar, Campus Oeste, ubicado en el 4101 de la calle Old Brownsville Road, de 3 a 6 de la tarde. La recolección continúa este jueves y viernes, 30 de abril y 1 de mayo, de 3 a 6 de la tarde. A medida de que las empresas reabran el 1 de mayo hasta en un 25% de su capacidad, la parte más importante para la reapertura es que los dueños de negocios tengan un plan. Si usted es dueño de un negocio, asegúrese de operar su negocio de manera segura y eficiente. Revise cada puerta, entrada y salida. Vea cómo puede limitar la exposición al virus mientras realiza su negocio de manera segura. El distanciamiento social es clave para minimizar efectivamente la transmisión del virus. La distancia social será clave para que todos se mantengan seguros, así que haga su parte por mantenerse a 6 pies de distancia.
Good afternoon, Barbara Canales, Nueces County Judge. Today, I'd like to talk a little bit about the order that I am actually just about to go and sign. It was being printed when I left. It's after 5 o'clock, so I'm going to file it with the county clerk in the morning, and it will actually get posted on the website in case anybody wants to take a look at it. And it will not take effect until Friday when my orders for our stay-at-home expire, which is a perfect timing because that's when the governor's orders also expire and the new orders take effect. So before I discuss the new order, let's go and talk a little bit about the current orders. First, we are completing our 28th day of a statewide and countywide stay-at-home order. 28 days of doing our part in a nationwide campaign called 30 Days to Slow the Spread. We have all made sacrifices in this time period, and some have found themselves with children at home, adapting to distance learning. I'm going to raise my hand. That's me. I'm certain it's many of you watching this today. Some have lost their job. That's my daughter in New York. Some have had spouses or relatives who were jobless, and planned events, special events like weddings, vacations, proms, graduations, all have either been delayed, postponed, or canceled. And many of us know someone who suffered from this illness, and we've lost loved ones in this community. And we took up daily practices when we stayed at home, when we wore masks, when we went to public places, and we practiced social distancing, and we washed our hands more than we've ever washed them before. And the good news is that 30 days to slow the spread has worked. It has worked here in Nueces County. The trend for new infections across Texas is lower, and because of this, Governor Abbott issued a new set of executive orders implementing phase 1 of his plan to open Texas. And those orders will take effect Friday, May 1st. And his current orders, including the statewide stay-at-home order, ends at midnight, April 30th, and my orders also end on April 30th. Now, we're going to talk about the new orders, but my old orders will end on April 30th, and so will the governor's. And so I know we're all so ready to move past this. Here it comes. But while my stay-at-home order expires April 30th, the spirit of that order continues. The spirit of the order remains. And last week, I told you 10 times, I would say it 10 times, and I probably said it 100. We must lock in our gains. This week, I'm going to tell you how we're going to lock in the gains. Last week, I told you that we're going to do it. Now I'm going to give you the recipe on how to do it. We are going to have a new mantra in Nueces County. We're going to stay strong to stay safe. Let me say that again. We're going to stay strong to stay safe, and I need you to stay strong. We all enjoy greater freedom of movement now with these new orders. You can almost taste that freedom, I bet. And I know people will want to go to do things they haven't been doing in the last 30 days, that want to go to places. I know that there's people that you're going to want to see. And while my order and the governor's order do not make it mandatory to stay at home, I want you to remember the spirit of that stay-at-home order. Do you remember? Because it's been a long time. Remember, it was talking about things you need to do rather than things you want to do. So I want to reiterate some of those important things because nothing has changed. We did not eradicate the virus. It's still here. It's still amongst us. It's caused people to be in the hospital, one of which is in intensive care right now. There are people that have recovered, and that is fantastic, but there are people that have not recovered. And there are people that are struggling with their recovery, and you need to know that. So when possible, stay at home. If you're going to go out in public, I'm going to highly encourage you to wear a mask. I want you to practice the social distancing that Annette, our local health director, Ms. Rodriguez, just went over, and I want you to continue to wash your hands. The temptation to not do any of those things is probably pretty great because you're feeling like something big has happened, and it has. This reopening of Texas, this incredible handbook, Open Texas. It's actually got a good feel to it, doesn't it? Even a good ring to it. It makes us feel liberated all over again. But I am very concerned that if I do not come up here and really tell you how important it is to stay strong, to be safe, we're going to go backwards, not forwards. So I want you to stay strong and stay disciplined. I want everyone to continue to practice all the good hygiene that we've learned. I want you to continue to limit your trips to essential activities if possible, and continue to maintain 6 feet apart and continue to wash your hands. And I want to stop here, even though this isn't in the notes, as they say, not anything I've written down, but I want you to know that there's not an order that makes you do any of the things I just said. But there is your common sense, and there is your ability to keep you and your family safe. And just like we started this journey together, we're going to finish it together. But you're going to have to pretend there is an order It's an order to keep you well. And you don't need me or my pen or anybody else to tell you what you know in your own mind is the right thing to do. But by God, I'm going to remind you of it every Tuesday and every Thursday until this whole thing is truly over. And the governor's orders and my order for Nueces County can continue to become less restrictive. You'll remember the governor talked about phase 2, and we're going to revisit my orders and his orders on May 15th. Or they can stay where they are, or potentially they can become more restrictive if we find ourselves in a bad place, which none of us want to find ourselves. And it's all going to be driven by the data. That's what the governor said, and that's what we've been saying here in Nueces County. And it will be managed on a county-by-county basis. So it's kind of like getting checked on. And we're going to know if we're doing a good job because the statistics don't lie. And we can get ahead of the state. That's where I want to be in Nueces County. I want us to be regionally ahead of the state because we can be held back from advancing the next phase if we're not. And again, if we stay strong, we're going to stay safe. Now, phase 1, just to remind everybody, does allow retail stores, restaurant, malls, movie theaters, museums, and libraries to operate at 25% capacity starting on Friday. We've already talked about churches and places of worship are still open. By the way, there's some great guidelines that a lot of the members of the interfaith community have helped us post on our website, and you should look at them because they were done for you to keep you safe as you worship. Outdoor sports are allowed to resume so long as there's no more than 4 participants playing together at one time. So there is no 7-on-7. It's going to have to be 4. And that'll be 2-on-2, not 4 with 4. And certain social distancing practices must also be followed. We've already talked about all these things, but they bear repeating. And the success of our phased approach depends on the residents continuing to practice social distancing and all of the things that we've talked about with environmental cleanliness. I'm going to tell you something. I got asked outside earlier, is this worrisome? Let me say it this way. I believe we have a tremendous challenge ahead of us, but I also believe I have a tremendous confidence in each of us. And as we open up our economy, we have to keep up the practices we've learned. And I said it yesterday, and I think that this is a good way to think about it. Do not let this enemy come in your home. Do not let it invade your workplace. Do not let it destroy the good that this county has worked for the last 30 days plus. And again, I told you about the detailed report that's on both the city and the county's website. This is what it looks like. I really like this, Open Texas. And it's got a series of checklists that really outline the minimum. Let me say that again. The checklists are the minimum. You can do more, and you should. We all should. We should want to do more than the minimum standard health protocol for all Texans. And I believe that there's special guidance, and Manager Zanoni referenced it, to Texans over 65, and a really detailed, comprehensive mitigation plan for nursing homes in Texas. And I just need everybody to know how committed this county is, how committed our joint emergency operations centers are to protecting the most vulnerable of our residents, which are not only the elderly, but those living with chronic conditions. There is a really vigorous testing and tracing program developed by DSHS that will help public health officials quickly identify and test Texans. And I'm very supportive of these efforts, particularly since they're happening all around us and they're really mitigating the spread of the virus and they're bringing in important data. I need you to know, and I told you we would be honest with you about testing. I spoke with Annette Rodriguez, our local health director, earlier today, and we're getting dry on supplies again. We need that reactive agent. We've got plenty of the VTM, and we have plenty of the swabs, which means we're not going to stop testing. But today I put in a STAR request on behalf of this county, and we need that nucleic acid, that reagent that makes it all work, that very end compound. And so I want you to know that, you know, every week is a new week with new challenges. But along with the mayor and the city manager and the health department, we're going to enhance our ability to get these resources, enhance our testing, enhance contact tracing. And I want you to know that it stands, as it always did, that this COVID-19 can infect anyone, regardless of age, and it takes a swift and terrible toll on those very vulnerable, but it is an insidious disease. And I really want you to know that I believe that we can safely revive our South Texas economy, and I think we can help each other recover. And that's what this whole phase one is all about. So we've come so far, and we've done so much to lock in our gains. And I urge you all to stay strong and stay safe. A very quick rendition of the orders that you will see online does two things, and I'm going to hone in on them, and then I'll be available for questions later regarding these orders. Number one, it pairs up our Nueces County orders with the governor's orders. That means his orders supersede ours, and on Friday, May 1st, his come into effect and our old orders go away. We adopt all those orders that the governor has inside Nueces County. And furthermore, I used language that, and I didn't bring it up here to the microphone, I should have, but I basically said that I highly encourage the wearing of masks. We highly recommend this for those individuals that are older than 2 years old. We don't want the babies using these masks. We ask parents to assist their children that are 10 and younger. We give operational meaning to what a mask is. It can be any type of fabric, a scarf, a bandana. We say that you should use these in essential places. You should use these in the reopened businesses. You should use these in public transportation and anywhere where you cannot social distance. Again, the governor made it clear yesterday that these are not enforceable provisions. Okay. We don't need them to be to do the right thing. And so I'm asking you, as somebody who is committed to this county and its emergency operations and the management, to please wear these masks when you cannot social distance and when you are in large public spaces and when you are on mass transit or doing share rides or taxis. This will keep us strong, and this will keep us safe. Thank you.
En resumen, las nuevas órdenes del gobernador entran en efecto este viernes. Aunque la orden de quedarse en casa expira el viernes, la base de la orden continúa. Así que quiero reiterar que el virus aún no ha sido erradicado. Así que cuando sea posible, quédese en casa y le sugiero que use un cubrebocas cuando esté en público. Siga el distanciamiento social y continúe lavando sus manos lo más seguido posible. Y aunque no haya una orden que lo obligue a hacer nada, le pido tener sentido común. Para recordarle, la fase 1 permite la reapertura de tiendas, restaurantes, cines y museos al 25% de su capacidad total. El manual con las fases e información detallada se encuentra disponible en línea en nuestro portal de internet. La dirección es www.cctexas/coronavirus. Recuerde, este viernes todas las órdenes nuevas entran en vigor y reemplazan a las órdenes actuales.
Good afternoon, Mayor Joe McComb. I've been asked several times during this whole episode, why do you get up there after Barbara's gotten up there and after Peter's gotten up there? Because you're saying a lot of the same things. And I said, good, you're listening. You know, I think they were kind of hoping there'd be a fight between what Peter says and what the judge says and I've said. But the bottom line is, we're here for the safety and health of our community, and we're all rowing the same way and going the right direction. So I've been told, you know, repetition is the key to learning, and so if you hear it from two different voices, two different angles, maybe we'll learn it. And I think that's the whole key to the success that we've experienced in Nueces County, and that is that we have low numbers compared to the rest of the state and the country. And we want to keep it that way, and we've got a lot of faith in our community. And so, yes, you'll hear a lot of repetition, but the bottom line is we're wanting to keep people safe. And you've heard the city manager referred to it, the judge referred to it, and a lot of people say, well, you guys have these documents and you don't provide them to the public. If the public doesn't have them, it's the public's fault because they're online on the city's website, on the county's website, I'm sure on the governor's website. They are readily available for anybody that wants to be reading from the same book that we are. And so I would encourage you to get those so you can see where we're coming from and what the plan is that the governor has. They obviously have put in a lot of work on this, and it's in the best interest of the state of Texas, and so we encourage you to look at that. Just a couple of reminders, and I'll try to be brief. One of the things that we did yesterday in the city's order, and again, the orders from the judge and the city have been basically reflective of what the governor has done, but there have been a few little tweaks, particularly in the cities, in that we implemented a short-term rental prohibition there for a period of time. But yesterday, we removed that from our order. And so that no longer exists. If you're in that business, you can begin to book visitors for the future following April the 30th, which is day after tomorrow, I believe. So that's some things that we've done. But the 25% is rule. Now, let me caution, I know there will be some that are excited and want to go to restaurants. And if those restaurants, in addition to having the restaurants, you can have alcoholic beverages, they have permits issued by the state. And if you get excited and you take a lot of pictures and you see that restaurant is, 40 or 50 or 60% full, and you want to show all your friends on Facebook, the next thing you're going to have is that they'll be able to tell just by the numbers that you're exceeding that 25% authorization in terms of your space, and you could create a problem for that restaurant. The restaurateurs, do a favor for your restaurateurs. Try to obey the orders. Stay at the 25%. If you have to wait a little longer or come back, do that. Don't risk getting them in trouble by violating the 25% occupancy for these next 2 weeks, because they want to get back in business, and they don't need some overzealous folks being excited about it, taking pictures, posting on Facebook, and then lo and behold, the agencies. And if you're in violation, I would think of your alcohol and beverage certificate issued by the state. That could create some issues for you. So just common sense, help the restaurateurs stay in compliance, enjoy their food, go out and spend locally as much as you can and whenever you can. But on the other hand, there's some people that aren't going to want to get out, and I can understand that. They'll be a little hesitant to go out and get in restaurants or go in and eat. That's fine. Nobody's forcing you to leave your home. Nobody's twisting your arm to make you leave. So you just, as they say, you're free to unbuckle the seatbelt and roam. But if you don't want to, you don't have to. So feel free to stay at home and continue to enjoy watching movies and having home cooking and having a fellowship with the family there. That's great. Nothing wrong with that. But you're not being forced to go out, but you've got the ability to go out. So those are some of the things. We'll continue to work to keep our city healthy and our county healthy. And again, just want to express a word of appreciation to all of those that have been involved from day one. I won't mention the name of a town, but somebody said they went to a little town one night and they thought they'd spent a year there. And some of us feel like we've been locked up for a year in our home with this thing. It's only been 30 days or 35, but it seems like a long time. But it's probably been good for a lot of people. And it's been good for our communities because we've stayed healthy. We've kept the numbers down, and we grieve with those families that have lost loved ones. And we're keeping, obviously, those in our prayers that are fighting the fight themselves with the COVID, and also helping fight those that have it, both in the administration of their business, whether they be nurses or doctors or medical technicians or first responders. So Corpus Christi, you've done a great job. Keep it up, and we can remain on this pathway to freedom in terms of our restrictions. But if the numbers start ticking back up, don't be a contributor to us having to go back in to this stay-at-home rule, because the governor has warned us that if the numbers take a turn for the worst, he will have no hesitation, because of the safety and health of our citizens, to reimpose rules. He doesn't want to, the judge doesn't want to, and I don't want to, but health and safety is what's driving us, and the numbers and the scientists and the doctors and the professionals will be giving us advice. But right now, we've got the green light to move forward very slowly, very methodically, and continue to follow the rules. So I would encourage you to do that, and hopefully the next week or 10 days, those numbers are to where everybody's satisfied. We go to phase 2, and that goes to 50%, and then I would think shortly thereafter it would be just full-blown open. So that's what we're looking for, and you can see some of the businesses, while they want to be open, they've already publicly stated they're not going to be opening till the middle of May, some till June, because they want to do it right. They're not if you don't have the time to do it right the first time, don't think you're gonna have time to do it over. So they wanna do it right the first time, and that's why they're doing it, because they deal with the large crowds, they deal with health and safety issues, and they just wanna make sure they're doing it right. So we appreciate your help, Corpus Christi, Nueces County. Let us continue to set the example, I think, for the rest of the state in our adherence to following the rules, good behavior, and our commitment to community and our fellow citizens. So thank you, and if I come back next time, probably it's gonna be a lot what the city manager says and what the county judge says, because safety and health of our communities is what our goal is. So thank you very much.
En resumen, es importante reiterar todos los cambios que van a ser posible este día viernes. Le pido que si va a acudir a un restaurante no viole las reglas. Cada restaurante tiene una licencia estatal en donde se le indica cuál es su capacidad total. Solo podrá aceptar en el comedor al 25% de la capacidad, pero si usted quiere continuar estando en su casa y cocinar ahí, hágalo. Los residentes de la ciudad han participado muy bien y esperamos así siga, pero todo dependerá de las cifras en casos por el virus para no regresar y volver a cerrar. En la fase 1, el 1 de mayo, las tiendas, restaurantes, cines, museos, bibliotecas podrán reabrir al 25% de su capacidad total. Para mediados de mayo, los salones de belleza, bares y gimnasios podrán aceptar hasta un 50% de su capacidad, si es que no existe una erupción significativa en casos por el virus.
Okay, that concludes our prepared remarks for today, and we're here to answer any questions, any one of our presenters. If there's any questions from the media. Yes, sir, Courtney?
Is there a status on what's being considered to manage the beach crowds?
The beach crowd. The judge may want to speak to that. We know that the beach, we're having to put more resources to keep that distance between vehicles. We know it was a very busy weekend, this past weekend. And the 8 o'clock curfew will go away on Friday. And the judge will have to speak of the distancing. But let me have her talk about a task force that she's putting together with the city and the county to see how we can handle that.
I asked Manager Zanoni to assist me in getting me the opportunity to have Assistant City Manager Keith Selman serve, as well as a council person at large, and also Greg Smith. From the county side, it's going to be Scott Cross, head of Coastal Parks, and Scott has pulled in the feds, the Padre Island National Seashore, the GLO through the state park, and also Port Aransas, and talk to the constables out there. Going to visit, Scott's going to reach out to the sheriff. The whole idea is that we need to create a consistent set of rules and guidelines that can be, easy for those visitors to understand. Our beaches are such that they don't stop, right? It doesn't, you have a federal beach, a national beach, next to a county piece of property, next to a city beach, next to port, it needs some consistency and some structure. And so one of the things that I noticed, and I said this yesterday, we do not have adequate information on signs. I want big signs out there to really stress the same things we talk about at these press briefings. If you're from out of town, you need to know what we expect of you with regards to social distancing and hygiene in the bathrooms and the pier. And the other thing we discussed is how difficult it is to patrol because of the sand conditions. And so there's going to be some possibility discussion of ATV-type vehicles that are out there. And I think that that's going to assist. What we really want is I care less about the cars and more about the people. What I want is when the people get out of the cars to social distance. And what I'd really like is to have more access roads available, and Coastal Parks is working on that, so that they can continue to go all the way down the beach. We are so blessed. This is not a little beach. This is a big, long beach. And we need to utilize that space. And I don't think it's good for anybody's health or for this community to congregate when it's not needed. And so I told everybody, I want you to jog, I want you to fish, I want you to surf, I want you to walk it, I want you to pick up shells with your children. But I don't see that I can only encourage you to please don't go out there to, party or picnic or do the things like that in this next 2-week period while we're evaluating. Give it some time. You've done so well. I mean, this is not the time to go free spirit here. I mean, the only spirit I want is the spirit of those orders. And so I think that that's going to be our mission at this task force. It sounds like, very official, but it's really just us coordinating with us as a community. But when I recognize that the pictures were awful, that we need to do better, I think it's got to be that we come up with some better set of guidance for people. I think people want to do the right thing, but I think without guidance, it's to be expected. So again, I'm monitoring the pier, and if the pier gets too difficult where social distancing is not possible, the pier will not be available. So we've got to keep up that opportunity to keep these assets open to us. So again, on Friday, the beach curfew will be lifted, and there won't be a discussion about how far away you are in your car, but there will be tremendous patrolling of the beach so that by our coastal parks team and by this task force, in the sense of we're all going to pitch in and start looking out for one another. And I think that's a good place to start. And again, we need to encourage our out-of-town visitors to be as good as our citizens.
Is this going on right now? I mean, are you guys starting patrols, and are you guys starting to meet?
Yeah, so
the
we've been
timeline?
patrolling. There's no doubt. I spoke with Constable Sherwood this morning. He's been patrolling. It's just difficult. I saw CCPD out there. Constable's been out there. Sheriff's been, we all have been working in tandem, but I think that what we need are vehicles that are more nimble to get in and out of the traffic on the weekend. And I also think that we need a chance to let people know what we expect of them. So I don't know about you, but when I drive over the causeway, I look at that text dot sign every time it says no close encounters of any kind, and it grabs my attention. And we need those types of quick graphics to grab people's attention and make sure they know that we expect them to act the same way that's given us these good statistics out there as we do inside a workplace or in a grocery store or in a public big box store. But it can't be that we abandon everything we know that makes sense when we go to the beach. And you know what? Like I said, there's just too much space. So you should enjoy it. I know I do, but I spread out, and I want you guys to spread out on that beach as well.
Okay, do we have any other questions? Okay, great. We'll be back tomorrow. Tomorrow's Wednesday. It'll just be myself and Annette, our public health director, and then Thursday, the judge and Mayor McComb will be back on Thursday. We'll see you then. Thank you.
Sometimes you may think you're doing the right